I'm Karina. I'm going to review alcohol withdrawal with Melinda and Tina. I'm going to go over the symptoms of alcohol withdrawal. The withdrawal symptoms should be anticipated if the individual reports consumption of over 10 drinks a day for a period of 2 weeks. This may occur within 4 to 6 hours after the last drink and may peak at 24 to 48 hours. This may last up to 5 days or even longer. In stage 1, this is your minor withdrawal symptoms. This is 6 to 36 hours after the last drink has been consumed. Here you have increased sympathetic autonomic nervous system output. The symptoms of this will include hypertension, an increased heart rate, a low-grade fever, anything greater than 100.5 degrees, anxiety, diaphoresis, nausea, tremulousness, increased hyperactivity without seizures, headache, shakiness, depression, fatigue, and mood swings. Your patient's mental status at this stage will be normal. In stage 2, these are major withdrawal symptoms. This will occur 12 to 48 hours after the last drink. The symptoms here include visual, auditory, and or tactile hallucinations, gross tremors, increased heart rate, diaphoresis, pallor, seizures, and alcohol withdrawal delirium. This will occur in 25% of untreated individuals. In stage 3, the patient will have seizures. These seizures can occur anywhere from 6 to 48 hours after the last drink. They can happen once or even be a brief flurry of generalized tonic-clonic type seizures. And seizure precautions should be implemented at this time. Grand mal seizures can occur in 5 to 15% of untreated individuals, and 3% of individuals will enter status epilepticus. In stage 4, you will see delirium tremens. This will occur in 48 to 96 hours after the last drink. And this is the most severe form of alcohol withdrawal. It can even lead to cardiovascular collapse. The symptoms will include delirium, paranoid delusions, severe autonomic hyperactivity, tachycardia, hypertension, fever, diaphoresis, severe anxiety, hallucinations, and seizures. The mortality rate here is about 5%. This is a table that shows the management and complications of alcohol withdrawal. And this is a CWA. This is a tool that nurses and other healthcare professionals use to determine where the patient is in the alcohol withdrawal. The assessment helps to identify the withdrawal process, to determine necessary treatment. It measures 10 symptoms of withdrawal, and they're all rated on a scale of 0 to 7. The symptoms are anxiety, agitation, auditory disturbance, clouding of sensorium, headache, nausea, vomiting, paroxysmal sweats, tactile disturbances, tremors, and visual disturbances. And the scoring for this, if it's less than 8 to 10, it will indicate a mild withdrawal. If it's anywhere from 8 to 15, it indicates moderate withdrawal, and anywhere above 15, it indicates that the patient is in severe withdrawal and detoxification is necessary. Okay, Tina will go over withdrawal treatments.
Identifying patients at risk. Some patients will hide or underestimate their alcohol misuse or dependence. We also use a CAGE questionnaire. It stands for Cut, Annoyed, Guilty Eye. There's 4 questions listed on this questionnaire. If the patient answers 2 out of the 4 questions yes, then they are at risk for withdrawal. Treatment is based on the patient's severity of symptoms. The CWA is used to determine the level of care necessary. Correct treatment can significantly improve patient outcomes, reduce costs, and help them avoid future hospitalizations. Some of the mild symptoms of withdrawal include headache, nausea, vomiting, insomnia, rapid heart rate, abnormal movements, anxiety, depression, and fatigue. Some of the supportive treatments include fluid and electrolyte replacement. Alcohol can be very dehydrating. It also depletes the body of electrolytes, so replacement is necessary. Dietary support is also necessary. The nutritional status of the patient can be compromised because alcohol interferes with digestion, storage, utilization, and excretion of nutrients. The patient is also at risk for a vitamin B1 deficiency, and this can lead to Wernicke-Korsakoff syndrome. This is characterized by extreme confusion, abnormal gait, and eye muscle paralysis. It can also progress to irreversible dementia. Alcohol also interferes with folic acid absorption, so folic acid supplements are administered to avoid developing anemia. Some of the moderate to severe symptoms include hallucinations, fever, convulsions known as DTs or delirium tremens. Benzodiazepines are prescribed to alleviate some of the moderate to severe symptoms. They work by reducing symptoms of anxiety and insomnia. They reduce and treat seizure activity, reduce and treat delirium tremors. There's long-acting benzodiazepines and there's intermediate-acting benzodiazepines. The long-acting are for patients who are experiencing recurrent withdrawal signs and symptoms, and an example of a long-acting may be diazepam, which is Valium. The intermediate-acting benzodiazepines are for older adults and critically ill patients who may metabolize benzos at a slower rate. This helps to avoid oversedation, and an example may be lorazepam. And now Melinda is going to go over discharge planning.
Discharge planning. Here's a quote on habits. Habit is habit, and not to be flung out of the window by any man, but coaxed downstairs one step at a time. Things to consider prior to discharge planning. The patient who is in withdrawal or detox is in a vulnerable state. Therefore, it is essential that the nurse provides non-judgmental, supportive, empathetic, and emotional care. It is important for the nurse to also consider that many alcoholic-dependent patients may suffer from psychiatric conditions such as anxiety, bipolar disorder, PTSD, and mood or personality disorders. Rehabilitation. The nurse should refer the patient to a short or long-term rehabilitation facility. These facilities may offer a variety of counseling options, both in individual or group sessions. Intensive outpatient behavioral treatment. These outpatient programs focus on relapse prevention and allows the patient to attend individual and or group counseling and rehabilitation sessions. Patients usually meet 3 days a week for 2 to 4 hours a day or more and are often scheduled around work and school. Some outpatient facilities may also provide the following behavioral treatments. Cognitive, which is behavioral therapy that seeks to help patients recognize, avoid, and cope with situations in which they are most likely to abuse alcohol. Family therapy allows addicts and their families to address a range of influences on abuse partners and influence overall family functioning. Motivational interviewing capitalizes on the readiness of individuals to change behavior and enter treatment. Motivational incentives use positive reinforcement to encourage abstinence from drugs or alcohol. Inpatient or residential behavior treatment. By removing the patient from their environment, this allows the patient to focus on how to live life without alcohol. Inpatient treatments can last 21 days or even 30 to 90 days if needed, with the major focus being recovery. A patient's day is scheduled with a combination of structured sessions and also personal time. There are lectures for the entire community and small therapy groups where the sharing of experiences and emotions lets everyone know they're not alone. There are also focus groups aimed specifically at addressing common obstacles and problems such as trauma, grief, and loss. With individual and group counseling, life skills training, 12-step meetings, and balanced nutrition, a patient learns about making better, healthier choices. What is the cost of rehab? A social worker can look into the different options in regards to payment by looking into the following. Firstly would be insurance coverage. If the patient has health insurance, the social worker will call and see about mental or health and substance abuse coverage. He or she can find out what out-of-pocket costs will be, including deductible and co-payment amounts. Programs that offer sliding scale or reduced payment options. The social worker can also check with the state substance abuse agency or call SAMHSA's helpline to ask about affordable treatment in the patient's area. Nutrition. With the help of a dietitian, recovering alcoholics can learn about these healthy choices. A diet high in carbohydrates, 100 to 150 grams per day, and high in protein, 50 to 80 grams per day, is recommended for a recovering alcoholic. Sugar and caffeine should be avoided in the early stages of recovery, as these are known to cause mood swings. Nutrition. High levels of serotonin helps to increase impulse control, relaxation, and the ability to sleep, while also decreasing irritability, depression, cravings of sweets, and tendency towards aggression. Tryptophan is integral to the production of serotonin and is found in foods such as bananas, milk, sunflower seeds, and turkey. Tyrosine is a precursor to the neurotransmitters norepinephrine and dopamine. It is found in protein-rich foods such as meat, poultry, seafood, and tofu. This can help increase the mental acuity and alertness. The support doesn't stop after being discharged. It's important for the patient to remember that they are not alone. Group meetings are a safe place where a patient can express their struggles with addiction, among others with a similar first-hand experience. Different support groups that the patient can utilize are Alcoholics Anonymous, Women for Sobriety, Secular Organizations for Sobriety, Smart Recovery, and the SAMHSA's website or helpline. References.